Hey everybody, Dr. Dan here with Beacon of Life Chiropractic, and we have Megan here with us this morning. And Megan's main concern coming in is chronic migraines, 20 to 25 days out of the month, severe migraine headaches, just debilitating. And I want to show you here on the picture what exactly we find to be the most common cause of migraines. And really when it comes down to it, after a thorough exam, almost every time what we find is that these top bones in the neck are misaligned. And so I just want to show you what we're supposed to see. And here we're looking at the side view of the neck, and she's looking this way. And the back of each of these blocks, they're the bones in the neck. They want to be right along that C-shaped curve there. And that would be a proper curvature in the neck. And what we see after a thorough exam of the nerves and the muscles and this, which is postural digital x-ray, is that when she's just standing there neutral, that curve in the neck that should be like a shock absorber for the weight of the head, it's actually going in the reverse direction. And so what that does is your spinal cord is basically just like this rubber band. And when you have the curve in the neck, the rubber band's nice and loose and relaxed. And when the curve in the neck is forward, instead of being relaxed, the rubber band or your spinal cord is stretched. And when there's that tension and stress on the spinal cord, that affects the nerves that go to the head and the sinuses and the meninges that go around the brain and the spinal cord. And that's the most common issue, the most common root cause when it comes to migraine headaches. So we're gonna be checking Megan today to make corrections to the alignment of the top bones in the neck to take some of that tension off of the spinal cord to really get to the root cause of the migraine. Megan, I'll have you climb up here. Yep, and we'll get you checked. So with the torque release technique, really what we do is a real-time analysis to see basically her spinal cord is running in between her spinal bones here, and we want to see which segment of the spine in the neck and in the low back, which one has the most tension on the spinal cord, or which one is the most misaligned at this given point in time, okay? So how we do that and test for the most tension on the spinal cord is by using the reflex of the Achilles tendon. So this is how we're gonna check her here. So it's very simple, nothing hurts, it's all very gentle, but very specific. All right, look to your right side and to your left side. Good, and back to middle. So based on what I see on this reflex here, just like if she was sitting up on the side of the table and we were to hit underneath of her kneecap there and tap the patellar tendon and it kicks her leg out, I'm doing the same thing when it comes to her feet, just real quick like that to engage the Achilles tendon reflex. And it lets me test the areas where the spinal cord, or the rubber band in this example, attaches to the bones in the top and the bottom, okay? So based on what I'm finding, we'll see where we need to adjust. Good. So the first one we're going to adjust is actually at the very top of the neck. So this instrument here is called the integrator, and it delivers a very, very quick and specific adjustment. Instead of me being real heavy when I adjust, we actually use more acceleration or speed here with this instrument to deliver the adjustment very specifically. So we're going to go ahead and adjust right up top here. Good, just like that. And what that did is it took the tension that was on the spinal cord from that x-ray being forward, we saw the curving forward in the neck, stretching the spinal cord, and started to take tension off and relax that spinal cord. So that's the first one, and each time that Megan's in, right side, we'll check up to 3 different segments. And back to middle. All right. And then we're going to adjust another bone at the top of the neck on the right side, right like that. Good. And once more to the right side and to the left side. So this is what a specific chiropractic adjustment looks like with the torque release technique. And what most people don't realize or wouldn't think of is that that cause of the migraine headaches that Megan's experiencing actually can come from the lower back and hips. Because see, how it works is that your spinal cord attaches to some bones in the neck and some bones in the low back. So if there's a curve in the low back or tilting of the hips, it's like having the rubber band or a guitar string having tension on it. And if you have a guitar string and you turn the one end of a guitar string to tune it, by turning the one end, it changes the tone of the whole chord. So sometimes, even though her main symptoms are up here with the migraines, you'll see me adjusting here in the low back and hips to take tension off that chord. So we're going to check for the third segment here. All right, it's actually L3, the third bone in the low back is where the greatest tension is right now. Good. Okay, and we'll post check. All right. And Megan, you can come on up there. So that's all there is to it when we're adjusting with the torque release technique. And I had mentioned that when Megan came in, she had 20 to 25 headaches, or migraines rather, per month. And about how many are you having now?
Probably like 3 to 4, maybe.
3 to 4, maybe, a month. So huge, huge improvement. I mean, that's got to be a huge improvement with your daily life. Yeah. I mean, when it comes to work and, I mean, the kind of work that you do and time at home with your husband. And, I mean, before, what was it like when you would have a migraine for a day?
I was out of commission. Just lay in bed, on the couch.
Yeah.
Couldn't really do anything. Couldn't do anything around the house. Couldn't go out, hang out, nothing.
It's crazy. So to see that improvement, it's just so dramatic, and your personality and your energy and everything just coming out. And I love to see that. And maybe some of you all who are watching this video deal with migraines currently. Maybe some of you know somebody who's suffering with a migraine and they need to see this video. So we ask that you share it with them. The thing is, as far as migraines, typically what we see is that people do a few different things for them. They might be taking prescription drugs or over-the-counter meds, muscle relaxers, Botox injections. There's all kind of different things that folks are told to do to treat and manage those migraine symptoms. But instead, what I encourage you to do is to check for nerve interference and spinal cord tension from that forward curve in the neck. They actually have a name for it. There's a medical diagnosis now. It's called tech neck or text neck, when that curve in the neck goes forward. Just for a little frame of reference here, in 1980, only 2 people out of 10 had a straight or forward curve in the neck. In 2018, the time of shooting this video, 9 people out of 10 that we see have a straight or forward curve in the neck. So if you haven't been checked for a forward curve in the neck, and you or someone you know or a loved one is dealing with migraines, we encourage you to get checked. So if you really want to get to the root cause of the migraines, then I really encourage you to find a neurologically based chiropractor in your area. Contact our team. Our number is 610-474-2481. And if you're local, we'd love to get you checked. If you're not local, we'd love to do some research and find somebody who can check you in the area. Dr. Dan here with Beacon of Life Chiropractic. Have a great day.